Welcome and thanks for joining us on the Flourishing Life podcast, where we will be discussing what we see on the daily. We're Jackie and Tad from Flourish Medical Wellness in Savage, Minnesota, where listening to our patients is the priority. Our foundational medicine clinic bridges the gap between traditional and functional medicine. We are pattern recognition specialists that focus on individualized patient care and health optimization. With a combined 30 years of medical experience, our goal is to provide insights that will help you take control of your health. Be sure to follow us on Instagram at Flourish Medical Wellness and on our website, flourishmedicalwellness.com, to stay up to date with what's happening at the clinic. The following content is the opinion of Jackie and Tad Tewes and is not intended to diagnose or treat any medical conditions. Please be sure to speak to your healthcare provider for your unique needs. Hey, y'all, Tad and Jackie here with Flourish Medical and Wellness, where our priority is listening to you, our patients, and practicing a team approach to foundational wellness and long-term healing. We are back with this podcast episode to talk all things men's health this month, and we are still continuing in our myths series and just talking about some of the things that we hear from patients that aren't necessarily the full truth or the whole truth, or maybe some kind of misinformation that they're being given. And so we're here to just talk through those things. So today will be mostly Tad diving in with men's health topic, and let's get started.
What we want to do is provide a lot of information, not only on things like healthy living, aging, overall wellness, but also, like Jackie had said, digging into some of those myths and helping provide some clarification in those areas. Myth number one, it's normal to fatigue, normal for energy to go down with age. And we do see that commonly, especially here in America, but it's so multifactorial. And that's where, as most men age, especially moving into their 30s and 40s, what we see on average for the majority of the male population is that they're moving into more sedentary roles with work. Typically, there's higher stress, there's higher demands. It's a time where there's also children and family and other obligations. All of that can play a role, along with lifestyle, in energy production within the body. When we dive into lifestyle for energy production, the big pieces that we look at are going to be dietary intake, with what a guy is eating, activity. We also look at stress and stress management, and also sleep, and seeing if that guy is getting adequate deep sleep, adequate sleep for recovery. All of these play a role in that natural production of the body of energy and metabolism. So if we dive into eating habits and the average American diet, when we were growing up, there was the food pyramid, right? And the food pyramid, this idea that things like cereal are good breakfast items, unfortunately have been some of the most widespread misinformation in this country that just have not benefited men in terms of overall health. The bottom line is, for most of us as men, as we age, we don't burn complex carbs as well as we did in our teens and 20s, unless we're doing things like endurance training. Now, for men who are getting ready for a triathlon, for men who are going out and running 40 miles a week, absolutely, complex carbs are necessary. We have to have those for energy. But for most of us who are doing shorter workouts, HIIT workouts, circuit training, that's where edging towards something that's more of a whole foods-based diet, prioritizing lean protein, vegetables, and fruits, will really help with overall energy production by improving how our body manages blood sugars with insulin. Because the last thing that we want for energy is to creep toward that pre-diabetes and diabetes, where insulin is not working as well in our bodies. Stress management is a huge thing that we talk about as well. And there's lots of components. We'll dive into that a little bit later. But also prioritizing not only sleep, but hormonal health. And then, again, getting into a good routine with activity as well. Let's get into myth number two. Drinking in moderation does not impact my health. And there's a mountain of research on this. Unfortunately, alcohol consumption is widespread in American culture, and it's something that is widely socially acceptable, but it can have big implications on how we function and how we age as men. Big ones that we see are going to be on energy production, because what it can do is not only decreasing metabolism in the body, but also affecting our hormones. See suppression of testosterone with regular alcohol intake. Guys who are drinking at least 5 to 10 drinks per week, we see that testosterone and that natural production tend to decrease over time. It also increases what's called aromatase activity, an enzyme in the male body that converts testosterone to estrogen. And because those molecules are incredibly close in terms of their chemical structure, when we ramp up aromatase activity, what we see is that mismatch of siphoning off the naturally produced testosterone, more estrogen, which can lead to its own set of side effects for men. Other things, thyroid is huge. Thyroid is one of our master regulator hormones. We've got this little butterfly-shaped gland in our neck, and regular alcohol consumption can down-regulate our production of thyroid hormones. It can also slow down that conversion of the inactive form of thyroid, which is called T4, to the active form of thyroid T3. And that T3 is our metabolic rocket fuel in the thyroid world. So when we're thinking about metabolism, energy production, how our bowels move, even things like heart health, we have thyroid receptors all over our bodies, and that's something where we want to make sure that our body is able to not only produce thyroid hormones, but then make that conversion possible from T4 to T3. A lot of that conversion occurs in the periphery of the body, but also in the liver, and so if we're bogging our liver down with alcohol, it will drastically affect that conversion process. And we can see this on lab work. There's a bunch of evidence on the effects of alcohol with regard to sleep, especially deep sleep. And what we tend to see in the studies is more fragmentation of sleep, or men waking up more often when they've had alcohol in the evening before going to bed, and then also cutting down on that deep sleep, which tends to restore the central nervous system as well. There are negative effects on mental health. Where I see it most often is actually with anxiety. There is a lot of evidence about mood and depression, but anxiety is the big piece, especially anxiety coming up the next day after alcohol consumption. That's something that we see commonly here in clinic, and a lot of that has to do also with the effects of alcohol on our naturally produced neurotransmitters in the brain. And finally, another big piece to alcohol is sexual function for men. There was a nice study done back in 2014 that looked at alcohol consumption in relation to erectile function and sexual health for men. And what they found is in small quantities that were very irregular, it didn't have a huge impact on sexual function. But for guys who were regular drinkers, so drinking over 10 drinks per week, what they found was a significant drop in erection quality and the ability to have fulfilling sexual activity for the male and his partner too. Clinically here, we talk about that every week at Flourish. All right, myth number 3, body composition. Body composition gets worse for all men as we age. And this is one of those myths where there is a little bit of truth woven into it, in that the natural trend for men and women as we age is our bodies become less efficient. I liken it to driving a car. Once you get up around 120, 150,000 miles, that car typically doesn't drive quite like it did when it was a new car, only had 10,000 miles on it. But there are significant pieces that we can put in place to continue having good body composition as we age as men. Again, the normal trend in America is that we become more sedentary. And so the change in body composition isn't necessarily due to physiology, but for many men, it's due to lifestyle changes. Going from a very active lifestyle in their teens, in their 20s, to a sedentary, high stress, high cortisol type lifestyle in 30s, 40s, and beyond. And one thing to know about cortisol too is cortisol can directly suppress testosterone production. And for us as men, testosterone is huge for body composition. It is our get up and go hormone, our body's desire to not only maintain, but gain lean body mass or muscle tissue as well. And when we see that cortisol rise, we'll see an inverse relationship to testosterone, where the testosterone will drop as well. And what that does is that swings the pendulum negatively for body composition, where we see more fat deposition, it becoming more difficult to get rid of that fat because there's a role of insulin resistance there as well. And testosterone levels just are not where they should be or where they were back in our 20s. Now, there is a natural trend for testosterone production to steadily go down with age in men. And that's something that is just normal physiologic function for men. But testosterone production tends to be a big indicator of overall health. And what I mean by that is we'll have men come in their 50s, 60s, and 70s here who are taking very good care of themselves, great lifestyle habits in place, and they'll have higher testosterone blood levels than many men in their 30s who are coming in with very poor habits, high stress, sedentary lifestyle, high alcohol consumption, very poor sleep quality. And so we get to see firsthand how much lifestyle influences testosterone production, especially when we get a guy in his mid-70s coming in with great testosterone, and then maybe a guy in his late 20s or early 30s where it's a third of what it should be physiologically. And all that plays a huge role in body composition. All right, myth number 4. One particular diet works for all men. And I should use the word diet carefully, and that's where a certain style of eating habits works for all men. And the truth is it just doesn't. Genetically, we're set up differently with how we metabolize macronutrients. And when I say macronutrients, we're thinking about carbohydrates, fats, proteins, and how we metabolize those and how our body responds to things like intermittent fasting and eating intervals plays a huge role in how successful certain eating habits will be for that individual guy. Things like paleo, keto, intermittent fasting, these are all eating habits that we can use, but it really comes down to whole foods. No matter what style of eating habit we're doing, the more we can center it around that foundation of whole foods, which is lean protein sources, vegetables and fruits, the better off we're going to be. And also with those vegetables and fruits, choosing organic is huge. Trying to decrease exposure to things like toxins, pesticides, because all of those can have a dramatic effect on metabolism and overall function. One thing that we talk about regularly is macros as well. And if we circle back to that food pyramid, that carb-heavy food pyramid, the problem is that if we eat carbohydrates in excess, you eat like the food pyramid, we as men end up looking like a pyramid, where we're adding on abdominal fat, and that is something that occurs more easily on average as we age, especially in the 30s and beyond. And so paying close attention to those ratios of protein to carbohydrates can be very effective for some men, not all, but some. And that's where trying to make sure that we're prioritizing lean protein, still getting some carbohydrates, ideally mostly from fruits and vegetables, can be very effective because it also helps control blood sugars and insulin levels throughout the day. And then finally, there is genetic testing that's available now to look at specifically how we are set up and how we break down and metabolize food, especially those macronutrients, proteins, carbohydrates, fats. And that genetic testing is something that we're bringing on to Flourish as well, to add another layer of being able to counsel people on the right dietary plans for that individual.
This is something that we've been really looking into for quite some time now. Feeling like this is a piece that we're still missing. I mean, we really prioritize individualized, personalized care. And I don't know that it gets more individualized and personalized than knowing what that genetic makeup and sequencing is. And so we're super excited to start bringing this in for our patients. The cool thing about the genetic test, it is a cheek swab and it is a one-time test. So once we do this, we don't need to do it again because your genetics aren't changing. And so this really gives us a genetic blueprint to what your specific genetics look like. And when we're talking about diets and the appropriate diet for you, it's going to look at how do you break down those carbs, the fats, the proteins, which way do you need to lean? And this is why, I hear patients come in, they're like, oh yeah, I listened to this podcast on keto, or I listened to this podcast on the carnivore diet. And they say it works for everyone. And the problem is it doesn't work for everyone. They're not wrong. And that diet probably really worked for them. But that's because genetically, that's how they are supposed to eat. And so now that we're able to really know that for the individual, It really helps to take the guesswork out of that. And so I'm super excited about this. So what it's going to do is it's going to look at how we process those things: carbs, fats, dairy, sugar. It's going to tell us some information about cravings, about how your body's responding to fats, cholesterol. And this one specifically that we're looking at isn't just about nutrients. It's going to give us methylation and detox and all of the things that we want to know genetically that's going on with you. This one has 120 different SNPs that it tests for. SNPs are single nucleotide polymorphism that's looking at that DNA strand, know what a typical allele or what that sequencing should be. And in some people, those are a little bit different. It helps us to understand how to better address those things for you. So diet is not a one size fits all. Unfortunately, there is not just one thing that works for everyone. Bringing on this genetic testing is going to help us serve you guys even better. So if that's something you're interested in, you've probably heard people like Gary Brecka talk about this quite a bit. So very similar to that type of testing. If that's something you're interested in, let us know and we can get that ordered for you. All right, number 5. So wrapping this all together, the thing that we hear from patients, they go to their doctor and they're like, you're just getting older. These things are normal. It's normal for you to not sleep as well, to have more fatigue, to see changes in your moods and your energy. And this whole, you're just getting older. Yes, you're getting older, but that doesn't mean that your body's still functioning appropriately and how it should. And that doesn't mean that maybe your levels like testosterone aren't dropping more quickly than they should. So Tad had mentioned, a 20, 30 something year old having lower levels than a 60 or 70 year old. And so that's really important. And that's what we see. So andropause, or, the decline of androgens or testosterone starts to happen. For men, it's usually starting in the mid 30s. For most men, we see about a 1 to 2% drop each year in those levels. So the things like Tad mentioned that contribute to this are going to be, the poor diet, stress, poor sleep, different types of medications, alcohol, all those things that he mentioned. If you wonder, could I be deficient in testosterone? The most common symptoms that we see are changes in mood, maybe feeling more blah or feeling more anxious or feeling more irritable. Maybe your kids push those buttons a little bit easier than what they had in the past. We see changes in energy. We see changes in the body composition, like Tad mentioned, changes in sleep, that deep sleep, lower motivation. So, it's I come home from work and I used to have the energy to go out and mow the lawn and do all the things. And now I just find myself sitting on the couch. That is a big sign that something might be off for you. Overall physical function and recovery. So with those workouts, are you recovering as well as you used to? If you're not, and you're not able to build that muscle mass, there's a good chance that testosterone has really dropped for you. Sexual performance, inflammation, and then joint pain is another big one. And I think for our men who are in high stress jobs and really needing that critical thinking skill, a lot of times we'll hear changes in cognition or just retention, and they just don't feel as sharp. So those are the types of things to watch for. If you're feeling that, get your levels checked. It may be a big piece of the picture and may be more important than you're realizing. And the good news with that is that even with that decline, we can help with that. So maybe we need to look at lifestyle. Maybe we need to give some supplements, which we'll touch on a little bit later. Maybe we need to put back in some testosterone because your levels are truly so low that it's going to be very difficult to get that back up with other things. And so there's lots of ways to approach that, but you're not just getting older. There are things changing physiologically in your body. And if you're having those symptoms, there's a good sign that is related to testosterone.
Yeah.
Okay. Number 6. A lot of times I'll hear from my male patients that, yeah, I actually did have this checked with my provider, but it's still in the normal range and it's just part of aging. It's just normal and that's just what happens. Again, this isn't necessarily always true because we have men who come in their 20s or 30s and their levels are super low compared to a 60 and 70-year-old. And so what causes this? A big piece of this is going to be toxin exposure, toxin load. We have so many, as you know, estrogens, endocrine disruptors in our environment, from plastics to pesticides to herbicides, things in our water. And so these are very, very common endocrine disruptors that we are being exposed to every single day. So this is a big piece of when we're seeing those levels drop prematurely, what could be the triggering factor there. And we can go in and help you get those out. The other big thing that we see is different types of medications. A huge one is statins. So statins are so commonly used here in the United States. So statins are things like simvastatin or atirvastatin or rosuvastatin, and these are things for cholesterol. Statins reduce cholesterol. I have yet to see a patient come here to Flourish who's on a statin who has healthy levels of testosterone up in that kind of 1/3 range. I don't see it because testosterone is made from cholesterol. If we don't have enough cholesterol in our body, we will not create enough testosterone. And that's not something that men are hearing. When we're using medications that change the way the body is working, there is this potential that it's going to mess with some good things that happen in the body too. And statins is one of those. If you're on a statin, I personally have seen that it every single time drops testosterone levels.
Yeah. And cholesterol isn't the big bad player that it was once made out to be as well. As we've gone through and learned more about the different functions of cholesterol, it's really a building material within the body. So we're talking about building cell membranes, building hormones, but then also acting as a binder and binding to some of those bad things that we want to get out of the body, specifically substances called lipopolysaccharides. And without cholesterol to do that, we can actually slow down some of the detoxification from our body with getting those LPSs out.
Yeah. And there was a study done probably 3 to 5 years ago now. We did have some posts on this, so you may have seen this, but they looked at the efficacy of statins, and it only reduced heart attack and stroke rate by 0.8 and 1%. So that's not very great, but it always answers the question of that, right? Like if we're lowering the cholesterol, why is heart attack still one of the top killers in the United States? But we've had these people on all these statins for years and years and years. It's not doing anything. And it's because cholesterol isn't the full story. It's not necessarily the driving force that's putting you at risk for heart attack or for stroke. And so that's something else we dive into here. There are other cardiac markers that I personally think are much more important to understand. Yeah. Things like a CT calcium score. If you are somebody who your doctor's saying, hey, your cholesterol is really high, you need to go on this, ask for a CT calcium score. They'll know what that is. That will tell us if there's actually plaque in there, and is this actually a necessary prescription for you to be on. So there are other ways to go about this, but sometimes you have to advocate for yourself and ask for further testing, like apolipo-B. There's different ones, and so we can help with that as well if you're not sure what that looks like. Okay, there are some other medications that can lower testosterone levels. Specifically, we're going to see this in things like opioids, so morphine, your oxycodone, your hydrocodone, so those pain medications. We can also see this with different types of beta blockers, so metoprolol, labetalol, atenolol, SSRIs. So these are going to be some of those medications for anxiety and depression. Those are going to be specifically things like citalopram or Celexa or Lexapro, Prozac, sertraline or Zoloft, fluoxetine, Paxil. I just like to put those names out because most people don't understand SSRIs. They know what it is. So if you're on one of those medications, it could potentially be lowering that testosterone level as well. And then we have to look at that SHBG, that sex hormone binding globulin, which binds up and blocks some of that testosterone. So maybe you're making enough testosterone, but if you have too much of that blocking protein, your cells can't use that testosterone at the receptor level. And so medications that can actually increase SHBG are going to be things like metformin and then some anti-seizure medications as well. All right, we are on to number 7.
So I want to go over a couple case studies here, and this gives an idea. We'll circle back to how impactful lifestyle can be on overall function and specifically testosterone production. And one of the reasons we're talking more about testosterone is that's the main feedback that we received from men for this episode is they wanted to know more about testosterone. How does it actually function in the body? Is it safe? Is it something that I should be looking at, or is it just a lot of hype? And so these are two guys that I saw here in clinic over the last 6 months or so, and they show a stark contrast in terms of how longevity and how lifestyle can be hugely impacted over time, over decades. And so one young man was a 28-year-old, high stress job, very poor sleep hygiene, regular alcohol intake every single night, and just didn't feel well. Lots of brain fog, was not functioning well at work, mental health issues as well, and then also more sedentary. He had gotten away from regular activity, was having a lot of trouble having the motivation even to get back into the gym. When he came in on his initial blood panel, his serum or total testosterone was at 173. And that's well below even what's called the reference range or reference interval. For a 28-year-old, that testosterone should really be at a bare minimum in the 500 to 600s, ideally higher. If he's functioning well as a 28-year-old, we're talking about 700s, 800s, 900s to really fuel his body and provide that hormonal support that he needs. On the flip side, another guy that I saw, 79-year-old man, retired, works out regularly, volunteers most days of the week, continues to do things that are also mentally stimulating, prioritizes sleep, whole foods-based diet, and his total testosterone came back in as a 79-year-old at 625. Basically, a reasonable range for a guy in his 20s and 30s. And so
I actually see that pretty commonly on my, older patients in that age range having higher levels. And I truly believe a big piece of this is the cumulative effect over time of how our culture and our exposures have changed. When we look at our parents or grandparents or people who are in their 70s or 80s, they would have a more whole foods-based diet. They weren't eating and snacking all day long. They didn't have as many chemical exposures in the air every single day. And that is, to me, one of the biggest reasons that we see. And then the stress levels, right? Like, it was just more live on the earth, do your job. Like, it wasn't all this go, 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 try to make more money. We have all these kids' activities. It was just more simple. Yeah. And I think that cumulative effect over time is draining our levels much more prematurely.
Myth number 7, your labs are normal. And typically what we hear is people come in not feeling well, not functioning well, and when men or women look back 5 to 10 years, they say, why am I not that person? Why can't I think this way? Why don't I have good energy? Why has my body changed? I've added fat around my midsection, but everyone's telling me my labs are normal. And it's important to understand what labs actually look at. When we get lab tests back, whether it's a major hospital system, LabCorp, Quest, any large lab, on the right side of the page, there's going to be what's called a reference interval or a reference range. Now, that is a range that is constructed by the lab for statistical reference. It is not an indicator of health. And that's incredibly important because our natural inkling is to look at that range and think, oh, this is the good or healthy range. And really what it is where 95% of adults who are our same gender will fall in, who are tested for that specific test by that lab. So even lab to lab, there can be slight variations in that reference range. Let me give you an example. So typically for men, that testosterone or total testosterone reference range will be about 260 all the way up to 920. So we're talking about almost a 4-fold increase. And this is common sense. If we look at that range and say, okay, any guy who falls between a testosterone level of 260 and 920 should be functioning well or should be in the good range. And that's just not true. When we look at quality of life studies and functional studies in men, there's a huge difference between how men function in that top third of that reference interval compared to the bottom third, which is more like 260 up to 420, let's call it. Another one we talk about often for men is thyroid function. TSH, thyroid stimulating hormone. This is going to be the most commonly drawn thyroid test in this country. On a lot of annual physicals, TSH is the only test that's drawn for thyroid, which is interesting because it's not even a true thyroid hormone. But the reference range for TSH is typically 0.45 up to 4.5. We're talking about a 10-fold increase within that range. And so it's not a good indicator of health, but all it does is show you where a person compares to 95% of their peers of the same gender, healthy and unhealthy. And that's why we look strategically at optimal reference ranges. So for a guy who's 62 years old, what should his thyroid function look like? How should his brain be talking to his thyroid to have an optimal feedback loop there? And what should that testosterone look like as well? The reason I bring up thyroid and testosterone is they're so impactful for how we function as men. If those two big pieces are off, it gets harder to lean on some of the smaller pieces because of how many hundreds of functions within the body that they impact.
Yeah, so what should a ideal, healthy, optimal testosterone level be? Like if our listeners have had their testosterone checked, right, and their doctor says it's normal or it falls in that range, but if it's 300, is that optimal? What is that optimal?
For a man who's, let's say, 36 years old compared to a man who is 65 years old, that can differ a little bit. But what we're looking at as just kind of a broad view, that upper third of that reference range. So usually about 700 up to 920, 950 is a lot of good hormonal support for men for a total testosterone level. That said, the more important testosterone marker is a guy's calculated free testosterone. And that's where we need to know what that SHBG level is that you were talking about, sex hormone binding globulin, because that is the main protein within the bloodstream that's going to bind to testosterone, even more so than how it binds to estrogen. And if that number is high or higher than average, we're going to see that free testosterone be lowered. And that's the available testosterone that's going to fuel all those metabolic functions for men. And so we need those pieces to understand that even two guys who have a total testosterone of 750, if their SHBG levels vary greatly, they may have totally different function because there's such a difference in the free testosterone that's circulating in their bodies.
Yeah, so an example of this, right? So you could have somebody come in, maybe your testosterone is 650 and your SHBG is 20. And you feel really good. A different guy comes in, same level, 650, his SHBG is 90. So he's not actually getting as much testosterone, free testosterone, available testosterone for his cells, for his receptors, as the first guy was getting. And most of the time, he doesn't feel good. He has the low energy, the poor sleep, the motivation. So if we're just checking that testosterone, it's not giving us the full picture. And the other piece that we really stress a lot here is how do your symptoms play with your levels? You cannot just make a diagnosis or tell somebody they're healthy or not, or they're normal or not, based on labs and numbers on a page. You also have to take into consideration what their symptoms are telling us about those levels. And that's a huge piece I think gets missed sometimes. Yeah. So to give you a picture of what this means, where this reference range or this normal range is giving us the majority where 95% of people fall. That means these ranges don't stay the same. They can change over time. And so as a country, as we get sicker, we actually see those ranges change. And it'll tell us that on the labs when we get them back. So for example, I had one in the not too far past where it showed us that there was a new normal range for blood sugar, so blood glucose. So there's a new range that's higher than what it was. Is that good? Does that mean it's okay for us to have higher blood sugar? Absolutely not. It just means that more people who have had the test done are having higher ranges. And so there's a new normal lab value. So hopefully that helps understand that concept a little bit more. Okay, number 8. This one is really exciting and this is pretty fresh here. So number 8, some patients come in and say, well, my doctor told me that testosterone isn't safe. There's a black box warning on it with regard to it impacting cardiovascular disease and heart health. And that is no longer true. So exciting news that that black box warning was removed from testosterone in February of 2025, and that mostly came from what was called the Traverse trial, which is a really important study that we will dive into a little bit deeper. But just know there is no longer a black box warning on that. This really stemmed from a few studies that were questioned by experts all over the world in testosterone, and they questioned the validity, the credibility, the accuracy of these studies. And so I won't dive into them too much, but I'll give you a couple high points on that. There were 4 big ones: Zarya in 2010, Viga in 2013, Finkel in 2014, and then You in 2013. And some were looking at observational studies, some were analyzing all of the different randomized controlled trials that are out there and putting those together and seeing what these studies have shown about testosterone and heart disease. The Tom trial was a really big one. This was a 6-month randomized controlled trial. The problem here is the study participants were older men who were not super healthy. Their average age was around 74, and they were using testosterone to see if it improved muscle mass, strength, their ability to just be more active, and it did. But what they found was that there were more cardiovascular events. Those cardiovascular events were PVCs or heart palpitations. Well, if you're working out more, you're more active, you might feel your heart beating more. These were not significant cardiovascular issues. It wasn't a heart attack, right? It wasn't putting these people in the hospital for major cardiovascular events. One of the studies was, looking at how testosterone impact cardiovascular disease in males, and studies had 10% of the participants as females. So to me, that automatically says, is this a really reliable study when we're not even using males, all males in the study? So we'll dive into, like I said, a little bit deeper into the Traverse trial and other studies that show that testosterone can actually be very cardioprotective and is important for cardiovascular disease. But there is no black box warning on testosterone, and that is not something that you have to be afraid of when we're talking about testosterone replacement therapy.
And to piggyback on that, as we learn more and as we do pick apart some of those previous studies, just like in women's health with the WHI study, we're looking at physiologically the role of these sex hormones, how they can be so beneficial in the body, but also how there have been some misrepresentations in the past with previous studies. And now as we get more and more well-done studies to back up the appropriate use, the appropriate function, appropriate levels of these hormones, that's the next wave of health and wellness and longevity in this country. This is one of the bigger pieces to that. Certainly not the only piece, but it's nice to move away from some of those big myths and misconceptions that have been floating around for a while. All right, I got the next one.
Number 9.
All right, number 9. My doc told me testosterone is bad for me. Okay, first and foremost, this is a very broad statement. We have heard this in clinic from men and women, actually. And the truth is, testosterone is an extremely important sex hormone made by both genders. Women actually make more. It is our main core sex hormone as men, with effects on energy, with effects on how we break down sugars with insulin. Testosterone actually helps our body to be more insulin sensitive to help keep us out of prediabetes and diabetes. Incredibly important for body composition and then supporting basal metabolic rate as well, because that's a huge part that relies on lean body mass and muscle. Incredibly important for mood, whether it be depression, whether it be anxiety, overall cognitive function. It's a sleep supporter, physical function and recovery. I liken testosterone to super ibuprofen. When we look at muscle recovery and the ability to work out hard as we age as men, testosterone is what helps us recover more rapidly from resistance exercise, HIIT training, longer endurance exercise. It's that super ibuprofen that we want circulating 24 hours a day, 7 days a week. And huge role in sexual health for us as men as well, not only with sex drive, but things like erection quality, ability to maintain an erection through sex, and all the different components that come with sexual health in males.
The key here to take away is Testosterone is needed for two things. Number one, it's needed for quality of life, just those symptoms that he just mentioned. And then also it's needed for longevity and for your organs. Your almost every single organ system has testosterone receptors, which means it needs testosterone to function well. Our brain, our bones, our heart, the prostate, the breast, like it is throughout the body. And so yes, it really, low testosterone impacts our quality of life, but it also can really impact and have negative long-term consequences on our overall health and things like diabetes and blood sugar and blood pressure when it is low for a significant amount of time and your organs aren't getting enough. All right, number 10. So if testosterone is so good for me, why is there this stigma? Why is there this stigma around testosterone replacement therapy? A lot of that came from two big things. Number one, the black box warning, the cardiovascular disease with testosterone, which we just talked about. And then the other big one that we hear is testosterone and prostate cancer. And so this is important for a couple things. Number one, men who have had prostate cancer and have had either their prostate removed or have had testosterone deprivation therapy, so they're limiting their testosterone they're getting, the impacts on quality of life are significant because again, it is that hormone that men's body feeds on. So when I was in school, and a lot of providers were trained the same, but the whole idea that testosterone causes prostate cancer, or it's like adding fuel to the fire. If you have prostate cancer, it's going to make it grow more quickly. That is simply not true. And I will do a breakout section of this podcast diving into the literature and the research on prostate cancer and testosterone and cardiovascular disease and testosterone. For those of you who don't really want to hear all the studies, but I will dive into it. We'll just separate it out so you don't have to endure through that if that's not your passion. We've seen several studies support this idea that is not the case. And there's this idea that has been brought to light probably over the last couple of years with the saturation model. And so what that's telling us is that when testosterone levels are at a certain point, there's a point that saturates the prostate. And so if your testosterone levels 250 or less, you can see an increase in the PSA when we increase testosterone levels because that prostate tissue is not fully saturated. If your levels are over 250, say 500, and we give testosterone, we typically aren't going to see a rise in that PSA level because that prostate is already saturated. And so we'll dive into this a little bit more when I do the study review for those two things. But that was a big piece of the scare tactic around testosterone and prostate cancer. It's not true. Testosterone doesn't cause prostate cancer. In fact, what we see is the most aggressive prostate cancers actually happen in men with lowest levels of testosterone. And so it's really, really important to understand and ask more questions about this if this is something that your provider is telling you, because it's not true. Number 11, testosterone is bad for the heart. We kind of already touched on this. I talked about the black box warning already. I'll go into the studies a little bit deeper. But the other really important thing to understand is the endothelial effects of testosterone on the heart.
So our miles and miles of blood vessels within the whole body have an inner lining called the endothelium. And that's that inner lining of the vessels that's in contact with blood as it flows through the body. And the endothelium has an incredibly important job, which is to be able to help blood flow function as it should. And this is also an area where if there's inflammation or damage, it can lead to plaque buildup and eventual blockage of those vessels, leading to things like heart attacks and strokes.
Okay, so endothelium in the heart, super important. We need to pay attention to this. What we know is that low testosterone or testosterone deficiency actually increases endothelial dysfunction and atherosclerosis, so the buildup of those plaques. So when testosterone is low, we have what's called pro-inflammatory cytokines and then anti-inflammatory cytokines. So pro-inflammatory cytokines are things in the body that are going to increase inflammation, and then anti obviously are going to reduce inflammation. So in males with low testosterone, we are going to see higher levels of those pro-inflammatory cytokines like IL-6, IL-1, TNF alpha. When we have sufficient levels of testosterone, we actually see more of those anti-inflammatory cytokines like interleukin 10. So remember, if you're talking to your primary or your cardiologist and they say, testosterone's bad for the heart, ask them, well, what does it do for my endothelium? Or if you're a provider out there and you're getting pushback from a cardiologist, and take a deeper dive with them into the pro-inflammatory and the anti-inflammatory when it comes to cytokines and interleukins in the endothelium. All right, number 12, testosterone cypionate is the ideal form of testosterone replacement therapy, or sometimes we hear all forms of TRT are the same, they're equally effective. Okay, so this also is not true. We have had experiences with patients coming to us and hearing things like this from their endocrinologist, or being told things like the cypionate, the injections are best, they work the best, they have the least side effects, it's not good to use other forms of hormones. When I hear that, what it tells me is that there is a lack of awareness surrounding hormone replacement therapy and the different options that are available, because that simply isn't true. So not all hormones are created the same. We often talk about the lock and the key analogy. So hormones in our body work like this. So there's a key, and that's your hormone, and it has to attach to the lock, which is your receptor on your cell. And so if that key is not a great fit for that receptor, it doesn't work perfectly. When we talk about hormones, they are the key, meaning they have a specific molecule structure, which is the key, and that structure, that molecule has to fit into the lock. When we are talking about things like testosterone cypionate, those are synthetic hormones. They're chemically made hormones, and they're not the exact same molecule. They're a little bit different. They have a little bit different structure to them. So that key does not fit perfectly into that receptor, into that lock. So it's really important to understand the difference between synthetic, they're not the same, and bioidentical or isomolecular, the same molecule. We prefer to use bioidentical or isomolecular hormones because we know that the body will recognize them, they will accept them at the receptor, they'll do the job. When we're trying to use these synthetic hormones, they're not exactly the same, and so there are higher risks of the body not knowing exactly what to do with that, or it triggering downstream reactions in the body that shouldn't be happening. The other thing that we see is looking at what we call hormone mimicry. So in my opinion, if I'm giving somebody hormones because their body is not making them as they should any longer, what I want to do is I want to mimic their body's natural production as closely as possible. So in a woman, that's things like cycling progesterone. In a male, that testosterone level is pretty stable for the most part. You're not going to have huge fluctuations every couple days. You're not going to have huge fluctuations on a daily basis. Well, you're going to see a little bit of an increase in the morning, maybe some increase after working out. Those are normal fluctuations. And so we want to mimic that. So when you're using different types of delivery methods, it will change that. So for example, if you're using a synthetic testosterone cypionate or an injection, they have higher peaks and troughs. So I used to use these when I worked in Alaina because it was the only tool that I had in my tool belt. And what we would see is we would have to dose patients a little bit higher so that their levels would stay higher for 2-3 days. And then they really start to drop off, and then they repeat that injection at about a week later. So they're doing weekly injections, having super high levels, steep drop off, and then repeating. You don't feel well. It's not great for your body. The red blood cells, it's confusing. It's like, why do I have all this? Oh, now I don't. Now I have this. Now I don't. The other thing I don't love about injections are they are in seed oils. And we often hear don't eat seed oils, right? Because they're super inflammatory for our body, for our gut. But yet we're injecting these hormones into our body that are in seed oils. A lot of men will have site reactions. And I also heard from some men injection fatigue, giving yourself injections every week. And if you're doing it right, it really should be twice a week, in my opinion. And that's a lot of injections. That can be exhausting to give yourself injections like that, that frequently. So, there are a couple other methods. There are gels, which can be bioidentical, which is great. And then there are also pellets, which I have found to be the most stable, the most predictable, more of that hormone mimicry, that from a consistent level. When you have pellets and you work out, you have increased blood supply, you're going to get a boost in those levels, just like your body would naturally. And so I have found those to really be the preferred method for many of my patients, from what they report back to me. You do have to be careful, because if you're working with a provider who maybe isn't as skilled at using pellets, it can be a negative. So too much of a good thing is never a good thing. And so you have to make sure it's being dosed appropriately, your timing is appropriate, you're not just putting more and more in, you're not treating to super high, super physiologic levels. That's not what it's about. It's really focusing on that hormone mimicry and trying to get in the right level in the right way for each individual patient.
Absolutely. And also pellets can help decrease some of the risks that come along with injections too. Like you had said, when we look at injections, weekly injections or twice weekly injections, as far as testosterone delivery, that's going to have the highest rate of excess red blood cell production in men. And it's something called erythrocytosis, or making too many red blood cells. And with these injections, because of its constant and regular stimulation to the bone marrow, we can see that red blood cell production even thicken the blood in some guys. The other piece is we tend to see higher estrogen levels in those men who are going through weekly or twice weekly injections because of all of those ups and downs. It really ramps up aromatase activity, that enzyme that converts testosterone to estrogen in both men and women. And that high estrogen can really stand in the way of guys feeling and functioning well too.
All right, 13.
Number 13. There's no way for me to increase my testosterone production. Simply not true. Lifestyle plays a huge role in that. Taking care of ourselves as guys. The foundation is going to be what we're eating, our eating habits and nutrition, activity, our sleep hygiene, and then how we're managing stress and toxin exposure. But beyond that, there are other ways. There are pharmaceutical means, medications like enclomiphene. That's going to be a medication that's a selective estrogen receptor modulator. Basically, it causes the body to produce more of the stimulating hormone to produce more testosterone, which can be effective in some men, not all, but it can be an option in some. Other things, testosterone replacement therapy is a good option for many men. But really starting with the lifestyle pieces, that's where we base everything off of, where if we can get that lifestyle right, we can see how well that guy's body is going to function physiologically when it's well supported, and then we can base decisions off of that once we have that firm foundation. All right, number 14. Are there any supplements that can increase testosterone? And yes, there are some that we use pretty commonly here at Flourish. One is called Tomcat Ali. If you do a Google search of Tomcat Ali online, you're going to get tons of information. But the main function that we see most commonly in men is it frees up more of that testosterone from SHBG, the main binding protein. So that way there's more of that free circulating and bioavailable testosterone within the bloodstream. It can cause a small increase in native testosterone production, but that does tend to be pretty minimal. Ashwagandha has gotten a lot of press lately, especially over the past 5 years, but ashwagandha tends to suppress cortisol. And if we think back, cortisol is going to have an inverse relationship with testosterone. So in most men, as we bring cortisol down, testosterone can rise, and we can see an improvement in overall function and health when we see that balance get to a better level. I use a fair amount of Thorne's Advanced Testosterone Support. We're not compensated by Thorne to say that. It's just a good supplement that tends to work in most men. Thorne's Advanced Testosterone Support has both ashwagandha, another substance called shilajit in there, and both of those work to optimize available testosterone within the bloodstream. The other piece too, it's pretty amazing to see when we look at alcohol intake specifically in men. If we change very little else with regard to lifestyle factors, what decreasing alcohol intake by 50 to 75% can do in terms of native hormone production in some men, especially men in their 30s and 40s. That's been a big surprise for me over the past 2 years is how much alcohol suppresses testosterone, especially daily drinking. So that's one of those pieces that we talk about commonly as well.
Okay, and number 15. So we do have to touch on this. If you haven't heard, there are some new oral options out there for testosterone. So we previously had some oral options for testosterone, and there were a couple issues with that. Number one, the liver was breaking it down pretty quickly, and so your levels weren't staying high, long enough, or levels weren't even, getting higher with that. And there was pretty significant liver issues with these oral versions of testosterone. So there are a couple new oral testosterone options on the market. Decanylate, and the brand names are going to be Kysotrex and the Jitenzo. And so here's my personal opinion. When I work with patients in clinic, one of the biggest issues that I see in American health today is poor detoxification pathways. So we're looking at the liver, we're looking at the gallbladder, we're looking at the lymph system. They created this new type of oral testosterone to bypass the liver and to be absorbed through the lymphatic system so that we can actually get those levels up and we're not harming the liver. In my opinion, the lymph system is much more of a delicate system than our liver. So if these oral substances were harming the liver, a super hardy organ that can regrow itself, and now we're sending it through the lymph system, that's a more, I think, fragile system in the body. That's really concerning to me. The main side effects that they would see with these oral medications were high blood pressure, which obviously, if we're clogging up the lymph, we're causing more stagnation, we're causing more fluid in the body, which is increasing blood pressure. Personally, it's not something that I'm willing to jump on board with. And then they're also synthetic, right? They're not a bioidentical form. And so we'll see. Here at Flourish, we're not ones to hop on the newest bandwagon. We really like to see what are the pros, what are the cons, do the benefits outweigh any risks associated with this. So there's more to come on this. That's how I currently viewing these, and we'll see what happens the longer they're out. They are twice a day dosing, so for some men that can be a negative thing as well.
I think we need to give those newer oral forms, the Kysotrex and Jitenzo, a little more time just to see how all this pans out, especially if there are any unknown effects on the lymphatic system that just have not become readily apparent yet. Those are things that giving these 5 years, 10 years, that evidence should be available at that time.
Yeah. And I think if you are somebody who's on those doing some lymph support, there are different types of lymph massages. There's a great supplement called Lymph Active that can really help the lymph drain appropriately. Rebounding can help with that too. So just being smart. If you're doing things even like alcohol, like let's support the liver. So there are ways to kind of help your body with that too, if that is something that you decide to do.
So if you have any questions or feedback, please reach out to us at Flourish.
I hope you took some good nuggets away from this episode for Men's Health.
Thanks for tuning into this episode for Men's Health Month. Follow us on social media, on Instagram, Facebook, or our website at flourishmedicalwellness.com. And if you felt like there was good information here, things that were applicable to your life and helpful to you, share this with others too. This is information that we want to get out so that people can really use the information, apply it directly into their lives, and have a lasting impact on health. But we will be back for the next episode in about a month here. God bless everyone.
The information on this podcast is for educational purposes only and is not intended to replace medical advice or to be a substitute for professional medical diagnosis or treatment.